The World Health Organization, after an international conference on primary healthcare in 1978, so quite some years then on into its existence, decided to shift to really sort of change their focus from a very curative approach in order to focus very much more on the prevention of disease. And they're not, and with this, they're looking not at symptoms of disease and working with symptoms of disease. They're looking at the fundamental root cause of disease. And so the Alma Ata Declaration, this was the first time the World Health Organization had really started seriously working in this direction. And trying to address disease, not just the progression of infection, for instance, but actually the overall structure of the way countries operated in order to prevent disease from occurring and in order to address that disease effectively when it occurred. So remember here we're talking not just about infectious disease, but we're also considering other non-infectious diseases. But at this point in 1970s, infectious disease was very much the main issue, and so that's what most efforts were focused on trying to deal with on a global basis. So they gave 8 crucial requirements in the Alma Ata Declaration for primary healthcare. So this was to provide education on health concerns and how to treat them. And this element of education could help people to make good healthcare decisions, good health decisions. And this can be simple things like WASH programs, so water, sanitation and hygiene. We are teaching people to treat their water before they drink it, teaching people to practice good sanitation practices, and teaching people to practice good hand washing practices. So simple educational measures like that, like using contraceptives, can do a great deal to prevent the ill health it causes. There's also the next part of the Alma Ata Declaration was to promote proper nutrition. With low levels, also with poor nutrition, malnutrition in the form of undernutrition, makes the body more, makes it weaker, and then makes it more vulnerable to infections occurring. It can also inhibit the development of children, so it can contribute towards poverty, which then contributes towards disease in later life. Can ensure adequate supplies of clean drinking water and ensure access to proper sanitation. Particularly around infant mortality, lack of access to safe drinking water and improper sanitation practices lead to a lot of infectious disease causing infant mortality. And this is typically caused through diarrhea-based illnesses. Provide maternal and child healthcare and family planning. So the point of birth for the mother still represents one of the at the time one of the greatest threats to health and the greatest chance of mortality for mothers, and this was very often because the mother's birth was not attended by someone who had relevant medical training, and there's very little in the way, very often very little in the way of medical care available if anything went wrong with the birth. So it was very dangerous going through the process of giving birth. And then for the process going through the pregnancy and in the early years of the child's life, in the particularly up to the first year, and then after that up to the 5th year of the child's life. If they get past their 5th year, then generally they're okay, but they're going to pass away, then it's over that initial period. And so it needs quite a lot of dedicated medical intervention to provide things like good healthcare education for good healthy practices, but dietary supplements if they're suffering from undernutrition, and to provide the usual course of vaccinations. Their family planning also became very it was also included in the Alma Ata Declaration to try to reduce levels of underage pregnancies, which are both damaging to the mothers and the children, and then to try to reduce the overall number of children that families were having through good family planning practices, so that the existing children were better cared for and there's less spreading of the nutrition and the wealth between a greater number of mouths to feed. The next part of the Alma Ata Declaration was immunisation of populations against major infectious disease. And this was to rapidly scale up immunisation and try to ensure good coverage of immunisation. Next one was to prevent and control local endemic diseases. So the Alma Ata Declaration was able to then adapt to the public health response to cope with what were issues within the locality, as what you may get in one country be quite different from another. In Declaration Area number 7 is provide appropriate treatment for illnesses and injuries, and then Declaration 8 was to provide access to essential drugs, which is by no means a given at the time. So in order to achieve these goals, the Alma Ata Declaration set goals for states to achieve around healthcare, and this provided what was possibly a very early precursor to the type of approaches that were taken through the Millennium Development Goals and the Sustainable Development Goals. By setting these targets, you could then measure the progress that countries were taking against the targets of the Alma Ata Declaration, and so therefore you could monitor progress on dealing with healthcare within these within these countries. So the initial target you get was for all countries to spend 5% of their gross domestic product on health, and amazingly, a lot of countries still don't provide that today. Next was to have 90% at an appropriate weight for their age, to reduce infectious disease preying upon weak children due to malnutrition, but also to try to reduce levels of stunting and reduce cognitive development due to malnutrition in early years, which then goes on to cause long-term healthcare complications and the inability to be economically active in later years for those people affected by malnutrition. To provide clean water, at least 15 minutes walk from all homes, and adequate sanitation within the immediate vicinity of homes, which was usually through a long drop toilet initially before you got plumbed facilities. Long drop toilets are simply a very deep hole with a small support structure at the top to stop people falling into it, and these pit latrines need to be dug away from watercourses to prevent leachates moving through the feces and into the watercourses. Make trained personnel available to attend pregnancy and childbirth, and offer childcare for kids at least till they're 1 year of age, as that initial year of life is the most dangerous and unstable part of the child's life, and where early care interventions make the greatest difference to the child's longevity and the quality of health in future years. The next step, then it drops down a step in importance from 1 to 5 years, but it's also still quite very important. So what the World Health Organization was trying to tackle with this was a holistic approach. It's taking a holistic approach to dealing with healthcare and trying to deal with not only the symptoms of disease but also the root causes of what were the main sources of disease as judged by epidemiological data.